The idea that I got additional care, additional scans, it was really reassuring to obviously see healthcare professionals at repeated visits through my pregnancy in particular. Yeah, the whole thing was just, I haven't really got a negative word to say about it, if I'm honest. I was recruited when I was pregnant at one of my early antenatal appointments, and I saw the poster in the waiting room and just made some inquiries with the team that were looking after me. And I think the thing that particularly interested me was knowing that there was going to be some additional input. I think it was particularly the additional scans that I was going to have, which I think kind of was a reassurance for me. It was my first pregnancy, so that felt like an added bonus really, and if I was helping kind of wider medical research in the process, then all the better. There was additional scans, and there was some medication that I needed to take, which was perhaps on the larger side than I realised it was going to be. But it was really reassuring. All the information was given to me. At the additional scans, they obviously, not only was it that I had additional scans, but they obviously took longer at each of those. So I felt like I was getting considerably additional care to the standard NHS service. So I was really reassured that my baby was developing the way that it should, and obviously if they'd found any problems or any issues along the way, then I felt confident that that was going to be made known to me, and I would have received the relevant subsequent care if it had been necessary. There obviously were some benefits to the study I took part in, which is even an added bonus, knowing that there's been some positive outcome. So I believe that when we had I think it's called a DEXA scan of your bone density, I believe that for those that, and I don't know which kind of tablet I took, but those babies that were, the mothers that were receiving not the placebo tablet, their baby's bone density was higher, I think, typically speaking. So that's obviously an added bonus. And I know now that nationally, I think as part of prenatal or antenatal care, mothers are encouraged to take vitamin D supplement, which is, I guess, in effect what I was potentially trialling at the time. So yeah, it feels really good to know that I was part of something that's actually had a positive outcome for future generations. If I'm honest, I've only got positive to say. Every time that I came to the hospital or had any telephone conversations or email correspondence, everybody was always very kind, polite, professional. Everything was done really timely. It was really encouraging, always with a smile. Clearly those individuals who are part of that research group, really passionate about what they do and believe in it. Which I think just sells the idea of the benefits that anybody can gain from taking part in such a study. I think if anybody was thinking of taking part in a research study, I would wholeheartedly suggest they did it, but I appreciate it can be a worrying thing to do, so talk to the team involved that are asking you, see if you can speak to some other or past participants and just get their feelings on how it all went. I understand it can be a worrying time, but there's huge things to be gained from it. Obviously my experience was having that additional care and support and feeling like I was really well looked after, and obviously the added bonus that potentially you might actually be doing something to help some medical research for the future and future children, generations, helping improve care for people. So a great thing to do.